There was a time in history when the term anti-vaxxer or the phrase gone down a rabbit hole were consigned mainly to websites dedicated to conspiracy theories. But since the pandemic, an entire community of people who doubt the efficacy and safety of the COVID-19 vaccine has emerged. They point to data around vaccine harms to strengthen their calls for an inquiry into the role Big Pharma has played during the rollout. But others argue that the millions who are vaccinated and go about living their lives as normal suggest that the extent of the adverse effects has been exaggerated. Now, earlier this week, spiked columnist Fraser Myers entered the argument with an article entitled "The Delusions of Andrew Bridgen," referring to the MP who was expelled from the Conservative Party for what he called raising concerns about vaccine safety. I'm absolutely delighted to welcome both Andrew Bridgen and Fraser Myers to Free Speech Nation. Thank you both. And thank you both ever so much for coming, and particularly because I think it's very difficult, it takes a lot of integrity to face your critics in the flesh, but also to face those who you have criticised in the flesh, and I think it's really great that you're both here. I'm going to come to you first, Fraser, because you wrote the article. Can you tell us a little bit about the article and why you felt you needed to write it?
Yes, I've been worried for a while about the rise of anti-vaccine conspiracy theorists, and for a while at least it seemed as if this was just a thing on the internet. You know, maybe you could ignore it, maybe it's a bit harmless, just a fringe, but a very vocal fringe. But now we have an MP among that ranks. You know, that's Andrew Bridgen sitting right here. Andrew will say he's just raising concerns about vaccine safety. He'll say he's just asking questions that others daren't ask. But actually, you know, a lot of what he says is really, really indefensible. So, for instance, he has compared the vaccine rollout to a crime against humanity, possibly the worst since the Holocaust. He has said that the pandemic is planned. He said that the virus and the vaccine were developed by the United States Department of Defense, and that we can soon expect our politicians and medical officials to be arrested. He said that the vaccine harms are so bad that they are the cause of the majority of excess deaths in the UK. Now, that would mean that they're more dangerous than COVID, more dangerous than the 7 million long NHS waiting list. Now, if those aren't anti-vax conspiracy theories, then I don't know what is.
Well, let's ask Andrew Bridgen himself. What do you make of those specific allegations?
Guilty as charged, and I've got the science that will back all of that up. What do we know about the vaccine rollout? That there's more yellow card reports of harms from the novel experimental mRNA vaccines, or the COVID-19 vaccines, than there has been for all conventional vaccines for the last 40 years. Figures from Florida, 1,600% increase in reports of vaccine side effects and the rollout of the COVID-19 vaccines. Only a 400% increase in vaccination. 400 doesn't go into 16. You know, it's just not how it's going to work.
So, Andrew,
four times the problems with these vaccines. They've never gone through phase 3 trials. They are experimental, and we were rolling them out to children. There's no children, unhealthy children, young children that have ever died of COVID, but there is clear side effects from the vaccines. Why are we doing this?
Fraser, are these experimental?
No, they're not experimental. They're not gene therapy either, which is like a common thing that anti-vax. Yeah, they're not, because they don't actually alter people's DNA, so they're not classed as gene therapy. They're not experimental because they have gone through clinical trials. The phase 3 trials have concluded. So it's just not true.
But you're not denying that people have had adverse effects?
Well, all medicines have side effects, and no medicine is entirely 100% effective. But what we're talking about here is, you point to, say, for instance, let's talk about the yellow card scheme, for instance. This is a way of people reporting the adverse reactions they've had from the vaccine. Now, the implication from Andrew is that this is a crime against humanity, that these people are practically at death's door. Actually, the vast majority of these reports are to do with people having sore arms, people feeling dizzy, people feeling nauseous, not the kind of thing that is going to have long-term adverse health impacts. So,
Andrew, what do you just to bring you in?
So grossly exaggerated.
Do you take Fraser's point that sometimes these things are conflated? You know, the harms that are lesser and the harms that are not.
Okay, so they're just normal drugs like all the others, and they've been fully tested. In that case, why do the vaccine manufacturers acquire full immunity from the harms that their products may cause before they'll release them? India is very shortly going to be the largest population in the world, the biggest market for drugs in the world. Pfizer have never rolled out any of their experimental vaccines in India because the Indian government won't give them immunity from prosecution for the harms. These are not new drugs, that they've been now rolled out for over 2 years. Billions and billions of doses have gone out, but they still require that immunity from prosecution. How can they be safe?
Fraser?
Well, as you say, yes, they've been being rolled out over the past 2 years, and we just haven't seen anything like the scale of harms that you're talking about. And conversely, we have seen that they have saved lives. I mean, back in 2021, when the rollout was, getting underway, you could see how these vaccines completely severed the link between COVID cases and COVID deaths. I mean, it was just undeniable. So I find it really, really disturbing that someone can take something as brilliant as these vaccines, this is incredible human scientific achievement, and basically trash them as evil, as part of some kind of plot. I don't know whether you think it's to make money.
Let's be fair to you, Andrew, because I think you should address that directly. Do you believe that it is a plot, that the vaccines have been created?
I think people have profited from these immensely. Yes, I do. But I mean, my degree is in biology, biochemistry, genetics, and a bit of virology. I mean, what are your qualifications in science to make the... Did you read any of the 32 papers I posted when I gave my first speech in December last year, on the 13th of December? That was all backed up with 32 scientific papers. Not a breath of it from the mainstream media, because they couldn't take it apart. The science was unarguable. At that time, the government wanted to vaccinate babies. They pulled back from that to only the over 50s and immunocompromised. And after my speech on the 17th of March, when I showed the number needed to vaccinate with a booster to keep one person out of hospital, which in, I think, the 40 to 49-year-olds was 932,000, with 1 in 800 having an adverse event, 1,100 people in hospital, keep one person out infected with COVID, at huge cost to the taxpayer. Then they pushed it to only the over 75s. If what I was talking about wasn't scientifically provable, why did the government move its position?
I suppose people are interested in, obviously we can talk about the statistics and the various studies, and that's very important that we have open discussions about that. I think some of the concerns that have been raised and what...
This is called Free Speech Nation. Yeah, I'm raising concerns, legitimate concerns, and growing concerns by the public. And if you can't do that in Parliament, where can you do it?
But I suppose it's the idea... I mean, I might
backed
be wrong...
up by scientific papers.
Fraser, am I suggesting, though, that when you said it's the plot element, the idea that it's a kind of...
Well, you're changing the terrain of the argument constantly. Yeah, you're saying it's like effectively comparing it to the Holocaust. In other places on the James Delingpole podcast, you said that the mandatory vaccinations for nurses was like the Nazis. How many scientific...
That's against the Nuremberg Convention at the end of the Second World War. You can't force someone to have a medication they don't want.
Convention, if not to say that these are a bit...
Andrew, do you think that just leaving aside the actual substance of the argument, but the language, the idea of invoking the Nazis, invoking the Holocaust, that's a legitimate criticism, isn't it, to say that maybe that's not a sensible rhetorical approach?
I was re-quoting a paper from the Hebrew University of Jerusalem
but you agreed with it.
by a Jewish
approvingly.
professor.
You quoted that approvingly. You didn't quote it to say, oh, my God, look at this idiot.
But it can't have been that bad,
what an outrageous
because I'll let you into a secret, Andrew. I've never had the codes to my own Twitter. My tweets are all moderated by my staff and have been for the last 12 years, and that tweet was moderated, approved and posted by my Conservative Association chairman.
Right.
But I was still throwing out the Conservative Party.
Well, I'm not trying to... I think everyone should have complete free speech in terms of what they say. That's not what I'm saying. All I was suggesting is, I think what Fraser's article was saying is that some of the rhetoric might not help the cause that you yourself are advancing. I think that's a fair point.
I think there's a lot of willful blindness out there. The fact is, Big Pharma is a huge lobbying power. 86% of the MHRA, the Medicines and Healthcare Product Regulatory Agency, which authorises these medicines, is funded by Big Pharma. The Joint Committee on Vaccination and Immunisation, in their personal declarations of interest, they declared over £1 billion of investments in Big Pharma. We've had our regulators captured. And that's just not healthy.
Fraser, you can understand why some people are sceptical about all of this, because there haven't been answers to all of the questions that people wanted.
I think that, we lived through a really terrible period during the COVID lockdowns. I think there were a lot of terrible mistakes. I completely opposed the lockdown. I thought it was a mad kind of authoritarian experiment, essentially. And I think that has, people, often people don't see cock-up where they're, or they see conspiracy where there's cock-up.
Yes.
And people are,
The only problem with saying it's cock-up, not conspiracy, what you've got to bear in mind is that all the governments across the Western world, the so-called democracies and others, made exactly the same cock-up at exactly the same time on exactly the same issue.
Well, they followed each other and they were kind of panicked into these decisions. And as someone who is critical of the lockdown and as someone who desperately does not want this thing to happen again, for someone like Andrew to essentially, espouse these are conspiracy theories.
If you don't want it to happen again, isn't the best thing we could do is find out who paid for and developed the COVID-19 virus, in which labs, and hold them criminally to account, because that was not a natural virus. I mean, the spike protein, a big chunk of it has come out of HIV, and 4 of the amino acids, which is 12 base pairs of mRNA, in the spike protein, the American government have got a patent on. It's not in any other coronavirus in the world. Why can't we find out where it's come from and who's funded it, and hold them criminally to account to make sure everyone gets a message so you don't do this again to us?
It's really important for people to realise that what Andrew says sounds scientific. It's kind of pseudo-scientific. It's, listing all these papers, misrepresenting the data, and, essentially it is a conspiracy theory. It has no basis in reality. There's nothing
I'll
that you've
send you
said.
the papers.
Well, you can send me as many papers as you like, but, a lot of these are complete outliers
but Andrew,
in terms of vaccine safety and things like that. So again, how do they prove a plot?
But let's try and bring it down to something specific, because you mentioned, Andrew, that you want to follow the money and you want to find out who's funding what America's involvement. And you did tweet to say that you had heard that the vaccine and the virus were developed by the DoD at Fort Detrick.
Yep.
Do you stand by that? Because you didn't provide in the tweet any evidence. But
I travelled out under my own powers at Christmas and New Year and spent the whole time in Washington speaking to scientists and elected representatives over there, and they confirmed everything about that.
But do you understand why people are concerned about that? Because when you tweet something that's so alarmist and extreme, but there's no evidence there for people to see...
Four of the amino acids in the spike protein, the American government had a patent on, and they gave it in 2014 to Moderna.
But you suggest that the virus originated at Fort Detrick. That can't be right.
I think a lot of the work was done there before it was shipped out by Anthony Fauci to Wuhan, and he funded the final research. What I don't know is whether it was released by accident or on purpose. I don't know how we'd ever find that out.
I'm happy for Andrew to discredit himself live by saying all this rubbish. It's just... You need to, wake up a little bit. This is not real. You've fallen down a real rabbit hole here. And it's very worrying that you're a member of Parliament. I think it's quite scary that, the British public are being represented by...
Anthony Fauci funded it. That's all come out in congressional and Senate hearings under oath in America. You watch the hearings, it's all there. The former head of the CDC said that that's what happened. Anthony Fauci funded it.
But that doesn't... Sorry, they have not confirmed that the virus was made by America, by the Department of Defense.
He took it from America and did the research in Wuhan.
But you haven't confirmed... I would love to see the evidence of the virus being created at Fort Detrick, because it sounds like a variation of an old conspiracy theory about AIDS being created at Fort Detrick. That was an old conspiracy theory.
It's not a conspiracy theorist that the Barack Obama, 11 days before he handed over to Trump, made gain-of-function research legal in America again. Why would he do that?
So
Why would you do that?
You take a grain of truth where it's like, perhaps the virus leaked from a lab, for instance. It could have been made in a lab. And then you extrapolate it to say that there is a conspiracy against it.
But do you think it was made in a lab or not? Was it made in a lab or not?
There are side effects to COVID, and then take that to say it's killing millions of... side effects to the vaccine, and then say it's killing millions of people.
We've got to go... We could talk about this forever, but I want to give you a final word, Andrew, on that. Do you have anything else to come back to Fraser on
well, it doesn't matter how long it takes. The truth will come out. It will come out who's funded this eventually, and it will come out about the side effects from the vaccine. Unfortunately, last week's excess death figures for, I think, second week of March, 22% above the 5-year average, 2,540 excess deaths. They're not statistics, they're real people. And it's going to continue, unfortunately. And we can't have a debate in Parliament about the excess deaths. How can that be? Why can't we have a debate about excess deaths in Parliament?
We absolutely should have a debate, but I think, the truth is not going to come out that the vaccines are causing it.
We can't even talk about it.
I don't think we're going to agree here, but I do appreciate you both coming on to have such a robust and open conversation about it. So thank you to Andrew Bridgen and Fraser Myers.